One of the procedures I offer to my patients and one I also get is lip filler. So I'm going to be sharing some of my top tips to consider if you're getting lip filler. This video is sponsored by RESTYLANE, a line of hyaluronic acid fillers that provides natural looking results. Check out the link below this video where you can sign up for Aspire Galderma rewards and receive $20 off your first treatment. Learn why RESTYLANE KYSSE is a great option if you're considering lip fillers. All right, without further ado, let's get into it. Tip number 1, know when to get lip filler. If you're brand new to lip filler, I recommend having your lips injected well in advance of any big life event like an anniversary or a high school reunion or a wedding. I'd personally shoot for over a month in advance if possible. Even if you're familiar with the procedure, you've had your lips injected before, you're familiar with your injector, I would still give yourself at least 2 weeks. Also, with regards to lip filler timing, I don't recommend getting lip filler if you are leaving town the day of your treatment or the day after. Ultimately, lip filler is a medical procedure and you want to have access to your injector just in case you have any questions or your injector wants to see you back in the office. All right, tip number 2, see someone you trust. I cannot emphasize this point enough. You always want to have your treatment done by a healthcare professional that you trust and someone who can guide you through the process and really explain everything to you. In my mind, a great injector isn't just skilled at helping you achieve a certain cosmetic outcome, but they have the knowledge and the experience to manage the entire process. They should be able to walk you through the consultation, perform the treatment, and be able to do any follow-up that is needed thereafter. Online reviews can also be helpful to an extent, but I do think you sometimes have to take those with a grain of salt. And then ultimately, you need to meet your injector, and it's okay to have a few consultations before you find that person that you really jive with and trust. Speaking of the consultation, that brings me to tip number 3, which is you may want to consider bringing a photo of your lip inspiration or be able to articulate what you're hoping to achieve with your lip filler treatment. A great injector is also an educator and should have the ability to sit down with a patient and help them define what a realistic lip expectation for them and their face should be, what those treatments may look like, and what products may work best for them. It's best to have a conversation about what you're looking for with an experienced injector so they can help guide you towards the right treatments and products for you. Ultimately, cosmetic treatments are a journey, and I really encourage patients to lean on their injector as a resource and as their guide. I have found that whether my patients are looking for a subtle lip augmentation or want lots of volume, they all really want natural looking results and to maintain natural movement. That's why I often recommend RESTYLANE KYSSE to my patients. It's a hyaluronic acid filler from Galderma. RESTYLANE KYSSE is designed to enhance lip volume, reduce fine lines above the upper lip, and provide a natural look and feel. It's also the first hyaluronic acid filler formulated with expression technology, which allows you to maintain natural looking expressions and flexible movement. I love using this filler in my practice because it not only helps my patient achieve natural looking results, but also allows them to smile and laugh and express their emotions all while still looking like themselves. I will also often get the question, well, how do your lips feel after you've had lip filler? And with RESTYLANE KYSSE, your lips will look natural and fuller, but they will also still feel soft and kissable. This filler has even shown to improve the color of your lips. Ultimately, it is the combination of your injector, the product being injected, and your lip goals that help you achieve the optimal lip augmentation for you. Okay, my next lip filler tip is to eat something and to hydrate before your lip filler appointment. Even if you're not a breakfast person, but you have a morning lip filler appointment, get a little something into your tummy. This will help you tolerate the procedure better. Also, you will be a bit numb after your lip filler treatment, and it'll be a little bit challenging to eat until the anesthetic fully wears off. So I just don't want you to be hungry or dehydrated. Tip number 5 is to minimize blood thinner intake prior to your lip filler treatment. That being said, if you had a headache or a sports injury in the days leading up to your lip filler appointment and you took some ibuprofen, that's okay. Just let your injector know and realize that it may increase your risk of bruising a little bit. Also, if you take prescription blood thinners for an underlying medical condition, do not stop those in anticipation of a lip filler appointment. My next tip is know what to expect while healing from your treatment. It's always better to know what to expect when getting lip filler, even though none of these things may happen to you. First up is swelling. Don't worry, swelling is common, and how much you swell really depends on the technique that's used, how much product was placed into the lips, and your own biologic tendencies. Now, the pink part of your lip can swell, but also the area above and below your lip can swell, and I think that's actually more stressful because people think that's their final result. But don't worry, that that swelling will resolve. You have to trust the process. Another thing that's pretty common after getting lip injections is tenderness that lasts a few days. Always check with your injector, but I typically advise my patients that they can take a little bit of Tylenol or Advil to help with any tenderness that's uncomfortable. Now let's talk about bruising. I always tell my patients to expect some degree of bruising. Many times they come back for their next appointment and tell me, Dr. Ellis, I didn't have any bruising at all. And that is amazing when that happens, but that should not be the expectation. Bruises usually last for about a week, and oftentimes you can cover them or reduce their appearance with a little bit of makeup. Another thing you may experience after having lip filler is lumps and bumps that you can either see or feel within your lip tissue. I always try to remind my patients that filler really is a gel-like substance, and especially in the first couple of weeks, that gel is really integrating with your lip tissue, and you might still have a little bit of inflammation or irritation around that gel, which allows you to feel lumps and bumps within your lips. The type of filler used can really set itself apart in this way as well, which is another reason why I recommend RESTYLANE KYSSE's expression technology, which really integrates into tissues. If it's been 3 or more weeks since your injection and you still have a lump or bump that's bothersome to you, check in with your injector. One other thing you can expect to have after your lip injections is chapped or dry lips. This is usually not due to the filler, but more so to the cleansing products that are used during your treatment. To help resolve this, use chapstick or Vaseline or the lip moisturizer of your choice for several days after your treatment. Speaking of what to do after your lip filler treatment, my next tip is to make sure to take care of your lips after your lip filler procedure. Now keep in mind, these are my personal recommendations, but it's always good to check with your injector to see what they want you to do as well. I like my patients to ice their lips on the day of treatment. I usually only have them ice for a few minutes at a time, and to do so a few times an hour for that first day. In my experience, this helps with both tenderness and swelling. Now, of course, if my patient has to go back to work or is not going to be able to ice, that is okay. It's just a recommendation. I also ask my patients to take it easy. I usually want them to avoid vigorous exercise for the rest of the day to minimize swelling and bruising. The last thing I have my patients do is leave their lips alone, especially for the first few days. I don't want them touching their lips a lot. I don't want them massaging their lips. I just want their lips to settle. This will help reduce the risk of side effects. So you want to ice, take it easy, and leave your lips alone. My next tip is to know what to avoid post-lip treatment. Again, these are my recommendations. Always check with your injector. Ideally, I don't want you applying makeup to the lip area for the first 24 hours after treatment. I also don't want you to kiss until your lips feel good and aren't tender anymore. I know that sounds kind of silly to bring up, but I always get asked, Dr. Ellis, when can I kiss again? I also will ask my patients to avoid elective dental procedures in the 2 weeks after their lip filler placement. And this is really to reduce the risk of irritation, inflammation, and infection. My final tip is to figure out a maintenance plan with your injector. Your follow-up will depend on if you're trying to increase your lip size, enhance your lip shape, or maintain your results. If you're getting lip filler, keep these tips in mind. The right injector and product will make all the difference. If you're interested in RESTYLANE KYSSE, check out the link below this video where you can get $20 off your treatment by signing up for Aspire Galderma Rewards. Once signed up for Aspire, you'll be able to earn points for treatments that can be redeemed for future savings. I hope this was helpful in your journey with lip filler. If you have any questions about lip filler, drop them in the comments below and I will be sure to answer. Thank you so much for watching. Don't forget to like this video and subscribe to the channel, and I'll see you next time.